Ultra AD is a medication used to treat sudden diarrhea, including traveler's diarrhea. It works by slowing down the movement of the gut, which decreases the number of bowel movements and makes the stool less watery. It can also be used to reduce the amount of discharge in patients who have undergone an ileostomy, as well as to treat ongoing diarrhea in people with inflammatory bowel disease. It's important to note that Ultra AD treats only the symptoms, not the cause of the diarrhea, so it's essential to consult with your doctor for the treatment of other symptoms and the cause of the diarrhea. If you are using Ultra AD to self-treat, make sure to read all the directions on the product package before taking this medication. Follow the dosage instructions provided by your doctor or on the prescription label. Take this medication by mouth after each loose stool or as directed by your doctor. The dosage is based on your condition and response to treatment. In children, the dosage is based on age and weight. Adults should not use more than 8 mg in 24 hours if self-treating, or 16 mg in 24 hours if under a doctor's direction. If you are taking the chewable tablet, take it on an empty stomach and chew it thoroughly before swallowing. If you are using the rapidly dissolving tablets, dry your hands before opening the blister pack to carefully remove a tablet. Place the tablet on the tongue, allow it to dissolve completely, then swallow it with saliva. No water is needed to take this medication. It's important to stay hydrated if you have diarrhea. Drink plenty of fluids and minerals, electrolytes, to replace what is lost. If you develop signs of dehydration, such as extreme thirst, decreased urination, muscle cramps, weakness, or fainting, contact your doctor right away. You may also need to switch to a bland diet to reduce irritation to your stomach and intestines during this time. If your diarrhea does not improve after 2 days, if your condition worsens, or if you develop new symptoms, tell your doctor. Seek medical help right away if you develop blood in the stool, fever, or an uncomfortable fullness/swelling of the stomach/abdomen, or if you think you may have a serious medical problem. If you are taking this medication under your doctor's direction for ongoing diarrhea, let your doctor know if your diarrhea continues after 10 days of treatment. Side effects of Ultra AD may include dizziness, drowsiness, tiredness, or constipation. If these effects persist or worsen, notify your doctor. Your doctor has prescribed this medication because they have determined that the benefit to you is greater than the risk of side effects. Most people using this medication do not experience serious side effects. However, seek medical help immediately if you experience severe constipation, nausea, vomiting, stomach pain, rapid heartbeat, severe dizziness, fainting, or signs of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed, contact your doctor or pharmacist. Using Ultra AD improperly, such as taking too much of it or using it for longer than directed, can cause serious harm, including a fast or irregular heartbeat, or even death. It should not be used by children under 2 years old due to an increased risk of side effects. Additionally, taking Ultra AD with certain other medications may also cause harm, so it's important to be mindful of potential interactions. Always follow the dosage instructions and consult with a healthcare professional if you have any concerns about using this medication. Before taking Ultra AD, it's important to consult with your doctor or pharmacist if you have any allergies or other health issues. This medication may contain inactive ingredients that could cause allergic reactions or other problems. If you have stomach or abdominal pain, bowel obstruction, black or tarry stool, blood or mucus in your stool, high fever, HIV infection/AIDS, liver problems, certain stomach or intestinal infections, or a certain type of bowel disease, talk to your healthcare provider before using Ultra AD. The rapidly dissolving tablets may contain aspartame or phenylalanine, so if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame or phenylalanine, consult your doctor or pharmacist before using this medicine. It's important to note that antibiotics may rarely cause a severe intestinal condition due to a bacteria called C. difficile. If you experience symptoms such as diarrhea that doesn't stop, abdominal or stomach pain, or blood/mucus in your stool, especially after recent antibiotic use, talk to your doctor before using Ultra AD. Ultra AD may also affect the heart rhythm, so it's important to inform your doctor if you have certain medical conditions or are taking other drugs that may cause QT prolongation. Additionally, low levels of potassium or magnesium in the blood may increase the risk of QT prolongation, so talk to your doctor about using Ultra AD safely. This medication may cause dizziness or drowsiness, and alcohol or marijuana can intensify these effects. It's important to avoid driving or using machinery if you experience these side effects. Older adults and children may be more sensitive to the side effects of Ultra AD, so it's important to use caution when taking this medication. During pregnancy, Ultra AD should only be used if clearly needed, and it may pass into breast milk but is unlikely to harm a nursing infant. Consult your doctor before using this medication while breastfeeding. Drug interactions can have an impact on how your medications work and can also increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Don't make any changes to your medication dosage without consulting your doctor. Some products that may interact with Ultra AD include pramlintide, recent or current antibiotic use, cholestyramine, ritonavir, and saquinavir. It's important to note that many drugs besides Ultra AD may affect the heart rhythm, QT prolongation, including amiodarone, chlorpromazine, haloperidol, methadone, moxifloxacin, pentamidine, procainamide, quinidine, sotalol, thioridazine, and ziprasidone, among others. If you or someone has taken too much Ultra AD and experiencing severe symptoms like passing out or trouble breathing, it's important to seek immediate medical help by calling 911 or your local poison control center. Symptoms of overdose may include difficult urination, slowed breathing, deep sleep, fast/irregular heartbeat, severe dizziness, and fainting. It's essential to take the correct dosage of Ultra AD as directed and seek medical help if there are any concerns. Always consult a healthcare professional before starting any new medication. If your doctor has given you a prescription for Ultra AD, make sure not to share it with anyone else. If you are taking Ultra AD on a regular schedule and you miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up. It is important to take Ultra AD as directed by your doctor to get the most benefit from it. Ultra AD is typically taken once a day with a meal. It is best to take it at the same time each day to help you remember. Ultra AD should be stored at room temperature, away from light and moisture. Make sure to store Ultra AD at room temperature and away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to disposal, never flush it down the toilet or pour it into a drain unless specifically instructed. Always discard the product properly when it's expired or no longer needed. If you have any questions about how to dispose of Ultra AD, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.